My name is Kathy Nolan. I was diagnosed with lupus in 1996 when suddenly I had terrible joint pain, fevers, swollen lymph nodes, and it literally seemed to happen overnight.
Lupus is one of those autoimmune diseases that can run the gamut from mild to life-threatening.
My first thought was, what happens if I can't take care of myself? I was single, I worked 2 jobs, my family was 12 hours away.
Almost every lupus patient just can't do what a normal person can do in the course of a day.
I get up and I actually limp for a while in the morning. My ankles, my knees, my hips, very, very stiff. By about 2 or 3 in the afternoon, I'm pretty well done for the day.
And certainly far too many people with lupus die at a young age.
My name is James Joseph. I was diagnosed with chronic lymphocytic leukemia on April 30th of 2001. I had always been active. I certainly never expected that I would have cancer.
Just to be confronted with a news that one has a malignancy, one immediately thinks of death. It affects not only the person, but really the entire family and the social structure.
I was 7 months pregnant at the time, and we thought maybe he had an infection. And so he went by himself. I wasn't with him when he was told.
As my white blood cell count continued to climb, which is the impact of the CLL, it reached a point where he decided treatment was appropriate.
Leading up to my bout with sepsis, I was actually on a personal vacation. I was traveling in Hong Kong for 2 weeks. I was out every day, just really enjoying myself out in Asia.
Sepsis is a disease syndrome of organ failure that can occur after pneumonia or other infections.
I came home on a Sunday morning and I went into work the following day and actually came down with flu-like symptoms during the week.
The core root of the problem in sepsis is that the immune system has gone into attack mode.
So the next morning, my husband suggested that we go see the doctor. I had felt so run down that I said, fine, let's go to the doctor, let's go get checked out.
Rather than simply fighting the bacteria that may have activated the problem, now it's as if the entire army has been mobilized and is shooting indiscriminately and injuring the organs and tissues that the patient needs to survive.
My lungs were filled with fluid. That one of my lungs was about to collapse.
This ends up being a situation out of control. These people end up in the intensive care unit on a downhill course.
Had I not gone to the hospital at that time, it's very likely that I could have died.
Feinstein Institute is comprised of 55 laboratories that are the home to some 800 scientists and clinical researchers. These individuals have dedicated themselves to understanding the molecular basis of disease in order to develop new cures. The list includes Alzheimer's, schizophrenia, autism, lupus, arthritis, Parkinson's, sepsis, chronic lymphocytic leukemia, and others. We have the technology and resources available to answer some of the most complex questions. How do these diseases develop? What causes them? And what can we learn about the disease today that will guide the development of new therapies in the future?
What's key in medical research is the ability to do basic science and to take those observations and then translate them into modalities that will help patients. And Feinstein is one of the few institutes that's actually built on that premise.
Having a research institute like the Feinstein enables investigators to work together very closely and also establishes a number of core resources that can be shared by everyone.
To my mind, the most important thing in science is actually talking to other people and getting ideas and then coming back and thinking about them. What's possible? What can we actually do together?
And our investigators focused on psychiatric disorders can collaborate with these individuals in order to bring the research to the next level.
The opportunities that are ahead of us are absolutely fantastic.
So she's entered a clinical trial of a drug called Benlysta.
You know, to me, it was a chance to actually get better.
We have brought new drugs to this disease that are more effective than some previous drugs we used to use and are safer. Her willingness to collaborate with us to learn more about her disease will help improve her health.
We were informed by our colleagues at Feinstein who had done the research. James's lymphocytes carried bad prognostic markers.
These laboratory markers have been important in allowing clinicians to identify how patients will do in the long run.
Without the research, I wouldn't be here. The therapies that were given to me wouldn't have existed. Perhaps even more importantly, the understanding of my disease wouldn't have been there.
The bench to bedside research is critical for today's modern medicine.
At this point, I consider myself to have been cured.
We came to know Jackie when she was admitted to North Shore Hospital, requiring serious life support to stay alive.
Once the emphasis on the problem of sepsis was shifted to understanding the damage caused by the immune system, it's become possible to think in new ways about developing therapies that go after the immune system itself. And we now see a pattern or a picture emerging from the pieces of this puzzle in a way that we had not seen before.
I live a very busy professional life. I do a lot of business traveling. I do a lot of personal traveling. So, I'm feeling 100% and back to living my life.
We're just thrilled with the success to this point, and we think we're not even at the peak yet. We think that there's a lot of great things coming in the future. Research is not local. Research affects people worldwide. So we should support the places that we think are doing good research because it's going to be for everyone's benefit.
Well, since I've been involved at the Feinstein, I realize how crucial it is to keep doing research on all the various diseases. Any one of us could have a loved one diagnosed at any time, and started with CLL, but I see what they're doing on all the diseases, and it is just so uplifting to know that this is all being accomplished there.
The history of medicine and the history of cures that have occurred point to a convergence of enthusiastic, curious, driven scientists collaborating and using their ideas in combination with breakthroughs that occur across multiple scientific disciplines. That cures disease. That has happened time and time again.
Hope lives here.
Hope lives here.
Hope lives here. Remember, hope lives here at the Feinstein Institute.